Hi, I'm Jordan. I'm going to do my health assessment video. I'm going to go ahead and scan through and make sure I don't have any notes anywhere. Okay, first thing I would do is I would check the chart, provide for privacy, go ahead and wash my hands, identify the patient. Can you tell me your name and date of birth?
Olivia Skaggs, 3294.
Okay. Do you know where you are today?
Your grandma's house?
And do you know what today is?
It's the 21st of October.
Okay. I'm going to do a little bit of an assessment on you. I'm going to go ahead and palpate your scalp. I want you to tell me if you have any tenderness or anything.
Okay.
Go ahead and put on gloves. Okay.
Nope.
Patient didn't know any tenderness. There was no nodules. It's symmetric. Head is normocephalic. I would like to know that the hair is of normal consistency. It's not coarse. It's not oily. Same goes for the eyebrows and the eyelashes. There's no inflammation or lesions on the eyelids. Okay. Have you had any dizziness or headaches?
No.
Okay. I'm going to go ahead and push on your sinuses. I want you to tell me if you have any pain.
Okay. No.
Okay, no pain was noted. Do you wear contacts or glasses?
I do not.
Have you had any eye infections?
No.
Okay. That tells me that optic cranial nerve 2 is intact. Normally I would use an ophthalmoscope to check for the fundus and make sure that there's a proper vein to artery ratio, but we're not going to do that today. I would also use a Snellen chart, but we don't have one available today. I'm going to have you look straight ahead. I'm going to shine this light in your eyes twice.
Okay.
Okay, there was consensual and direct accommodation. I'm going to have you look straight up. When I ask you to, go ahead and focus in on my pen light. Go ahead. Okay, there was proper accommodation. Without moving your head, I want you to follow my pen light.
Okay.
Okay, patient was able to follow the pen light with no issues. There was no ptosis of the eyelashes. No drooping, so that tells me that cranial nerves 3, 4, and 6 are intact. Have you had any issues with your nose lately? Any smelling problems?
No.
Okay. I'm going to go ahead and look up your nose.
Okay.
Okay, it is moist and pink in there. The septum is not deviated. The outside of the nose is symmetrical. There's no lesions or anything like that. Have you had any issues with perception on your face or paralysis?
No.
Okay, I'm going to go ahead and poke you with something. I want you to tell me if it's dull or sharp.
Okay. Dull. Sharp.
Okay. Can you puff up your cheeks? Show me your teeth. And raise your eyebrows. Okay. Tells me cranial nerves 5 and 7 are intact. I'm going to have you sit up just a little bit so the camera can see you.
Okay.
All right. Lean back. Okay. I'm going to have you open your mouth and say ah. Okay. Uvula was midline. Have you stick out your tongue. Raise it up and down. Side to side. Say light, tight, dynamite.
Light, tight, dynamite.
And go ahead and swallow for me. It tells me cranial nerves 9, 10, and 12 are intact. The mouth was moist and pink. Tonsils were a +1. There was no abrasions or lesions in the teeth, and the gums looked normal. No bleeding or inflammation or discoloration. Okay, I'm going to have you go ahead and sit up. I'd like to note that there was no JVD noted. I'm going to have you close your eyes, and I'm going to talk on either side, and I want you to tell me which side I'm talking on, okay?
Okay.
Peanut butter.
My right side?
Peanut butter.
My left side.
Okay, good. Go ahead and lean back for me, please. I'm going to push on a couple points of your ears. I want you to tell me if you have any tenderness, all right?
Okay.
I'm going to push on the tragus, pull on the pinea, and push on the mastoid process.
Nope.
Okay, there was no problems with that. Cranial nerve 8 is intact. Normally I would look in your ears with an otoscope. I would pull up on the pinea and back and look for a pearly gray ear drum with no fluid to make sure that everything's fine in there. So I'm going to go ahead and push on your shoulders. I want you to push up. Okay, cranial nerve 11 is intact. Look up for me, please. Swallow. Okay, trachea is midline. There was no protrusion from the thyroid. It's symmetric. There's no pigmentation. I would also like to note that the lips are moist and pink. Pull down on your eyes. Okay, the sclera is proper color. It's moist, it's white, and there's no swelling of the conjunctiva. I'm going to have you open and close your mouth. Okay, there's no crepitation or popping in the TMJ joint. I'm going to test for your skin turgor. There is no tenting. I'm going to go ahead and palpate your lymph nodes. I want you to tell me if you have any pain.
Okay.
Here's the preauricle, postauricle, occipital, the tonsillar, the submandible, submental, superficial cervical, deep cervical chain, posterior cervical, and the supraclavicle. There's no palpable lymph nodes and no tenderness. I'm going to have you touch my finger with your nose. Okay, good. Have you had any stiffness of your joints or anything like that?
No.
Okay. Let me know if you have any pain. Okay, capillary refill is less than 3 seconds. Go ahead and grab my fingers. I'm going to pull. I want you to pull back. Push, you push back. Okay, good. Come down to the leg. Push chapstick. Take the socks off and test for the capillary refill. I do see that the patient has painted toenails, so we're going to test for the capillary refill at the top. It was less than 3 on the feet and the fingers. I'm going to push down. I want you to push up. Good. Push down, you push up. Good. I want you to run your tibia along your shin. Okay, on the other side. Good. Okay, I'm going to have you stand up. I'd like for you to walk towards me. Okay, I'd like to know that the gait is coordinated and balanced. Go ahead and lean over and touch your toes. Okay, the spine is straight, so that's good. You can go ahead and sit up. Sit down on the bed for me, please. I'm going to have you touch your ear to your neck, your shoulder, chest to chin. Okay, good. Go ahead and lean back for me, please. Patient held proper eye contact throughout the interview so far. She has proper facial expressions. Her skin is warm. I don't see any lesions or bruises anywhere. I would like to note that the patient has a tattoo on the back of her neck. Skin is not dry or moist or anything. I'm going to go and chart my findings. I'd like to note that the nails do look normal. There doesn't seem to be any grooves or discolorations within them. Can you put your hands out like this for me, please? Okay, and like this. Good. Okay, I'm going to go chart what I find. Is there anything that you need?
Nope.
Okay, I will be back shortly. Thank you.
Thank you.